Welcome to Tucson Indian Center 2021 Virtual National Native HIV/AIDS Awareness Day. With this event, I would like to encourage you to get educated, get tested, get involved in prevention, and get treated for HIV and AIDS. My name is Marlene Francis Jose, Tucson Indian Center Health Promotion Specialist. During this difficult time, stay healthy, wash your hands, and have a positive attitude. Native Americans have been resilient for generations, and you can find solutions for situations. Be a positive leader for your family and community. Thank you.
Good day. My name is Veronica Boone. I am Laguna and Navajo and enrolled in the Navajo tribe. I am also the new Wellness Director for the Tucson Indian Center. I've been in Tucson for about 26 years and have worked primarily at the Tucson Indian Center, but I've also worked with other tribal and state institutions here in the Tucson area. But my heart has always been with improving the lives of tribal and Native Americans, particularly urban Native Americans here in Tucson. So this is my passion and this is what drives me. So I've returned in the role of a department director, and I'm committed to providing quality health and wellness programs and services to the Tucson urban Indian community. I look forward to serve and thank you for this opportunity and will do my best. So with today's event, we have the National Native HIV/AIDS Awareness Day that has been coordinated and put together by one of our longtime staff members, Marlene F. Jose. So I want to be sure to say thank you to her and for the invite to speak at this event. A couple of things that she asked me to talk about in relation to COVID-19 was masks and social distancing. So again, with this pandemic that's raging, right now, these are two of many tools that we can use as a community that we can use to prevent COVID-19, so slowing the spread of this respiratory virus. So you'll be likely using these tools and continuing these same actions for some time into the future. Some estimates are that we might be continuing with these different things until at least 2022. So I would urge you that even as more and more people get vaccinated, we're starting to see some downward trends of the virus and the pandemic. And I think people are just at that point of being tired of being in the pandemic. They're tired of wearing masks. They're tired of restricting their activities. But I urge you to reconsider, and that we also need to continue using these different tools to prevent the spread of the virus. And again, we can't let up now. The tools add an additional layer of safety for you, your family, and the community. So for those who have already been vaccinated, you are continued and urged to please continue to use these tools. Again, masks and social distancing, washing your hands and other things like that, even though you have been vaccinated. Other tools and things that you could do in addition is to avoid touching your face, your eyes, even your masks with unwashed hands. And if you do happen to touch those areas, please wash your hands for at least 20 seconds with soap and water. We also need to maintain social distance of 6 feet. So that's about 2 adult arm lengths away from other people. And this is especially important for those who are not in your household. And this also applies to both indoor and outdoor spaces and maintaining that 6-foot distance. There's a fly here. So the question is, why 6 feet? Well, research indicates that respiratory droplets do not travel more than 6 feet. So droplets coming from a person's breathing, talking, sneezing, coughing can go anywhere from 3 to 6 feet from the infected person. So that's why there's the 6-foot distance or recommendation. So the question might come up is, how is this virus spread? It's spread primarily through respiratory droplets from an infected person. So every time someone talks, laughs, coughs, sneezes, exercises, and even sings, even just by breathing, we're exuding or putting out these droplets from our breath. Well, what happens when someone has COVID-19 and doesn't wear a mask? Or someone with COVID-19 might have an improperly fitted mask. So what they're doing is their droplets are spreading around them, and that's the critical time that people around them can catch those droplets, breathe them in. Maybe they take the droplets that the infected person is exuding, might land on your eyes, your nose, your mouth, and then that elevates your risk of getting infected. So masks are critical in keeping the spread of the virus on a downward trend. Masks are a critical tool in keeping the spread of the virus on a downward trend. So note that a mask is not a substitute for social distancing, and wearing a mask should be done in conjunction or along with social distancing. Masks are a simple barrier to help prevent your respiratory droplets from reaching others. It has been shown to reduce the spray of droplets that you put out if you properly wear your mask and it has a good fit. So masks should fit over the nose and mouth, and it should fit snugly against the sides of the face and without any gaps. So it's recommended that your mask be multiple layers of fabric so that it's not a single layer and that you increase your protection. So there are a couple of shoulds that you should keep in mind when wearing a mask. You should wear a mask even if you don't feel sick. Masks should be worn anytime you go out in public or if you are around people who are not a regular part of your household. These can include friends and relatives who you don't see on a day-to-day basis. So again, you're urged to wear your mask during these times. And masks should be worn in your household. If anybody in your household is sick or they're showing signs and symptoms of COVID-19, you want to do what you to keep yourself safe. So wear a mask even in your household, again, if someone's test positive or are sick with COVID-19 symptoms. You're urged not to touch your mask or the mask of your child. If you do, wash your hands with soap and water for at least 20 seconds, or you could use hand sanitizer. But please use hand sanitizer that is at least 60% alcohol after touching or removing your mask. So with the shoulds, there's also should nots. So you shouldn't wear a ill-fitting mask, especially one that's too large. So if you do wear a mask that doesn't have a proper fit, it releases the droplets off the side or even on the top of it. So you want to make sure that you are wearing it properly, and also that you don't pull your mask down. Make sure that your nose is covered when you're wearing your mask. Don't wear a mask that is made of leather or plastic or something that's hard to breathe through. So we want a mask that's preferably cloth or cotton that allows for air to go in and out, but the air or the fit or the material itself will catch the respiratory droplets. So it still allow you to breathe, but it will also catch the virus from leaving your mask if you're infected and for breathing in other people's droplets. So how do you tell if a mask has is a good material? So one thing you could do is with your mask, you can hold it up to a light source and see if any of the light penetrates or comes through the mask. If it is, then it's the holes in the material are too big, which is going to allow respiratory droplets to be passed in and out of your mask. So wear a mask where, again, just testing with the light source to see if your fabric will trap the COVID-19 droplets. Do not wear a mask with exhalation valves or vents. The reason is that these exhalation valves and vents still are allowing your respiratory droplets to escape the mask, so renders it pretty much useless. One of the other should nots is that you shouldn't wear a scarf, a ski mask, or a bandana in lieu or in place of a mask. So again, you're looking for a good quality cloth mask, and you can even double up on the mask, so you could wear a disposable mask under a cloth mask, which is highly recommended. Another topic that I was asked to present on is social distancing. So you might wonder, what is social distancing? Social distancing is keeping a safe space between yourself and other people who are not from your household. So again, the 6-foot distance that is recommended, you hear about it all the time. So that's 6-foot distance. So in looking at the material for this topic and social distancing, I thought of what locations actually might increase our risk of contracting COVID-19. I was thinking of crowded, confined spaces with poor ventilation. Locations that come to mind would be festivals, concerts, school, public transportation like a plane or a bus, church, theaters, restaurants, malls, grocery stores. So again, these have large amounts of people in a limited space. So those are definitely areas that you should avoid. And if you absolutely have to go out, for example, for food, for medication, please follow these recommendations. Maintain a 6-foot distance from others who are not a part of your regular household. Pay attention and follow any physical guides, such as tape markings on the floor or signs on the wall while in public, that help to increase the social distancing. Other recommendations: stay home when you're not feeling well or if you're feeling sick, and stay away from, if possible, from others who are not feeling well or who are ill. We'd recommend that you limit trips to grocery stores, being out in public, by thinking of other ways that you might get the resources you need. For example, you might use drive-through, curbside, or delivery services to get your essential items. Visiting friends and family, you might consider the telephone, video chat, other social media, just to keep in touch with others while still maintaining a safe distance. And I'd ask you to consider to cancel or don't attend large group gatherings, and then also to limit long-distance travel. So all this information that I'm giving you is not for me. I've actually garnered this information from the CDC, which is the Centers for Disease Control and Prevention, the Mayo Clinic, the University of Chicago Medicine, Johns Hopkins Medicine, and then also looking at some articles by Dr. Fauci, who is the director of the National Institute of Allergy and Infectious Diseases. So these tools, these recommendations, masks, social distancing, are critical. They're crucial in battling this virus. And I understand they can be a pain. I do get tired of it too sometimes, but they do add an additional layer of safety, again, for you, for your family, and for the community. Well, before I go, I just want to thank you for your time and attention. We have a great event lined up for you, but I also want to leave you with some reminders of the things that we offer at the Tucson Indian Center. If you did not know or were unaware, we do have a new health services department led by Phoebe Cager, and through her department, they're offering a lot more COVID-19 services. For example, they are now offering free weekly COVID-19 testing on Tuesday afternoons, and this is limited to those who are enrolled in the health services department and are tribally enrolled in a tribe. So you have to complete the enrollment forms and be screened the day prior, which is on Mondays, and you need to have a scheduled appointment. So the first step to get the free COVID testing is to contact the Tucson Indian Center Health Services Department. You could email health@ticenter.org, or you can call us at TIC at 520-884-7131 and ask for the Health Services Department. Hopefully in the future, the Tucson Indian Center will be able to offer COVID-19 vaccines, which we don't at this point, but that is something that we're working toward. But in the meantime, if you need masks, hand sanitizer, personal protective equipment, things like that, please contact the Tucson Indian Center. you have the option of asking either the Health Services Department or the Wellness Department, and we'll do what we can to assist in getting you these items that you request. So just note that our building is currently closed to clients and the public. We do have a tentative date to reopen on April 1st. But again, this depends on the pandemic, so hopefully things continue to decrease and things get better. But in the event that it doesn't and things go in the opposite direction, we might have to push back that date. But for now, our reopening, again, to the public and to clients is April 1st, and that would be for scheduled appointments only. So please check our website, check out our newsletter, call us if you're interested in more information. As staff, we are still working for you. We do provide teleservices, which include phone calls, emails, faxing. We send things through UPS, the U.S. Postal Service, FedEx. So we're still here. We're still answering phones. We're present in the building, and we're here, and we wish to help. So just let us know how we can be of service to you. And with that, I just want to say be well, be safe, and thank you.
Hello everyone, my name is Dearlyn Crank and I'm a Wellness Case Manager at Tucson Indian Center. This presentation, I'm just going to give you a brief overview of the services that Tucson Indian Center offers and ways that you can be involved and keep updated with our services, our events, and our activities that we have going on throughout our year. The 5 departments that we have at Tucson Indian Center include the Administration Department, our Finance Department, Wellness Department, Social Services Department, and Health Services Department. But I am only going to focus on the Wellness Department, the Social Services Department, and the Health Services Department to show you the services that we offer when you enroll into the different departments.
Skutash Anyabtugik Jerry Romero, and I work for the Social Service Department. I am the Intake Supportive Case Manager for the Social Service Department. So my responsibility is to make sure that all documents that are required for you to enroll into our WIO program is collected by me. And then also too, after everything is collected from me, you go to the next step, which is the assessment process, and that'll be with Stella and also Tiffany. So for the Social Services Department, we help clients find jobs here in the urban area, as well as if you need assistance for resume. We do have what we call our job clubs every Friday, but at this point during this pandemic, we're not having job club for now, so we're doing everything through email. But also too, you can email us for information about getting enrolled into our program here at the Tucson Indian Center under the WIOA program. So Social Services Department is, we do a lot of stuff. We try to connect with the community here in the Tucson area with jobs listings from all over Tucson, as well as the reservations at the nearby with Pascoyaki and Tono Alta Nation. So anything that pertains to job-wise, resumes, we do have resume workshops here at the center too. As like I mentioned, we are doing everything virtually. So if you want information to get enrolled into our WIOA program, please email us here at the center anytime, Monday through Friday. We're here from 8 to 5 every day. So again, I encourage you guys that are looking for jobs or for relatives and friends. And again, you do have to be Native American to participate in our program because we're here for the urban area here in the Tucson area. So that's what the Social Service Department is. So hopefully we get to hear from you and see you soon. Thank you.
Hello, my name is Dylan Bisa. I'm a new member of the Health Services Department here at Tucson Indian Center. My primary role here is as a COVID-19 CHR or Community Health Representative. And right now my main focus is on providing testing and resources to those struggling with the pandemic this year. We do have a weekly testing event every Tuesday outside in front of the Tucson Indian Center on the sidewalk from 1 to 3. And if you're interested at all in getting testing, I highly encourage it, and please reach out to us.
So the wellness department is broken up into 8 different programs. Our programs you see here are listed. Title V, which is case management, community health representative, and transportation and medication deliveries. 4-in-1 program, which focuses on health promotion, diabetes prevention program, exercise and nutrition. Tribal practice for wellness, cultural activities. Native Pride Project, which is methamphetamine education and suicide prevention with youth up to age 24. Tobacco prevention for youth and adult tobacco prevention, Stevensville Youth and Community Health Education, and Native Connections Project, which is the substance abuse and prevention with youth up to ages 24. And to utilize all these services, you would contact a wellness case manager, which is myself or Christina Luna. We do an intake, and the intake is fairly long, but it could be done within a good 15 minutes. Along with the intake, we do require vital documents that completes your intake to the wellness department. We ask for your state ID, a copy of your tribal enrollment or tribal ID, Social Security, birth certificate, proof of address, and or health insurances. And with that, you do the intake packet, you meet with the wellness case manager, they get you enrolled and do a case plan with you to utilize our wellness department as a whole, and if not, Tucson Indian Center as a whole. Some ways for our clients, community, and those afar to keep updated with Tucson Indian Center and the activities and events that we have going on is through our website, and that is www.ticenter.org, or through our Facebook page, which we are very active on. We have been utilizing our Facebook page to go live, to provide informational and educational sessions. Because of the pandemic, everything has switched virtually. So we utilize our Facebook and our website quite often. Next is our newsletter. Our newsletter could be emailed to you or physically mailed to you. You could sign up on our website, or you could call Tucson Indian Center, and those who answer will connect you to the right person to get you signed up with our newsletter. Some upcoming Tucson Indian Center events to keep a lookout for is our Take Down Tobacco, which is tentatively April 1st, 2021. TIC's virtual job fair, which will be April 23rd, 2021. World No Tobacco Day, tentatively May 28, 2021. And to be announced is our Women's Day, which is usually in May, our Men's Day, which is usually in June, and our Native Youth Summer Program, which is in July, and our Back to School Bash, which is usually in July or August. So those are some of the events to keep a lookout for. We usually do an announcement in our newsletter, on our website, and our Facebook. We have been utilizing Facebook to create event pages, so it's a great reminder for you to tune into these virtual events. And we also do Wellbriety checks every day and usually let our clients know of the Tucson Indian Center events. If you have any questions about the things that Jerry, Dylan, and I have shared in this presentation, don't hesitate to contact Tucson Indian Center at the following phone number, 520-884-7131, and our hours of operation are Monday through Friday, 8 a.m. to 5 p.m., not including federal recognized holidays, and we usually take those days off. But you are welcome to call, and if no one answers, go ahead and leave a voicemail and we will be sure to get back to you. And if you would like to contact me directly, my extension is 2231 and my email address is dcrank@ticenter.org. And I just want to share with everyone that our events for now are virtual until further notice, and hopefully with the vaccines and everyone continuing to follow CDC guidelines, we will meet in person soon. Continue to stay safe, and we'll continue to serve you telephonically in whatever ways are best. Thank you.
Hello, my name is Lori Fantry, and I am here. Thank you for the invitation to talk to you all about HIV and AIDS awareness. So before starting, I just want to give you a little bit of update as to what human immunodeficiency virus is. It's a virus, just like COVID that we see out there. It only affects humans. And what we talk about with HIV is the viral load. It's the number of virus particles that you have in your blood. And that's very important to know how infectious you are and if you're going to get disease from the virus. And it's not actually the virus itself that actually causes people to die and have significant suffering. It's that it attacks the immune system. And this is the system in your body that makes you you can defend against bacteria and virus and all kinds of other infections. And the cells that HIV attacks are the CD4 cells, specific cells that fight infections. If a person has a normal CD4 count, it's greater than 500. A mild to moderate suppression is 200 to 500, and less than 200 is severe suppression. And these are people living with HIV that have the possibility of having a defective immune system. So in the United States, we still have this epidemic roaring. Not so much in this country as, say, in sub-Saharan Africa, but we still have many, many states that have high rates of HIV. And as you can see here, Arizona, we're a moderately severely affected state with the epidemic. We have 13.1 cases per 100,000 per year. And we haven't really made too much stride in the last few years as controlling the epidemic. As you can see, around 2011, we were actually doing a little bit better, but cases have been kind of trending upward, especially to 2014, and they've kind of stabilized, and maybe there's a little bit of a drop off in 2019. And we have a little data on the state of Arizona. So in 2019, there were 18,462 people with HIV/AIDS. There were 776 new cases, and the incidence rate was about 10.7 cases per 100,000. This is newer data than showed on the other map, which was 2018. And as you can see, it's actually Maricopa County has the highest number of infections, and that's probably mainly because it's the most largely populated county in the state. But as you can see, there's other counties, Pinal and Graham, that actually have higher rates, okay? Smaller populations, less number of cases, but the rate of HIV is actually higher. And if you look at Pima County, we're actually the fourth highest rate of HIV, new HIV infections in the state. So it is a problem for sure here in Pima County. And we are particularly concerned about Native Americans because it looks like, rates in African Americans may be declining a little bit. Rates in whites are declining a little bit. Hispanic Latino population, that's a population we're concerned about because rates really went up for a while. They've stabilized a little bit. But the American Indian and Alaskan Native population, it really is trending a little bit upward. The number of cases are low, but we are concerned that it's trending upward. And if you look at the HIV incident in our state, as you can see, and this is the rate. So as you can see, as one might expect, African Americans have the highest rate, Hispanics have the second highest rate, but as you see right here, the third highest rate is among American Indians and Alaskan Natives, although I'd say primarily in Alaska and Arizona, it's going to be American Indians. So we also, I'm going to pass through those slides a little bit. So what can we do? Okay, we have a big problem here. What can we do? The big things that we can do are test, treat, and prevent. There's 1.1 million persons living with HIV, and the status of being unknown is about 14%. So 14% of people living in the United States with HIV do not know they have HIV. Testing, we recommend that testing is done basically for everyone between the ages of 13 and 64. And you should be tested at least once if you have no risk factors. If you have high risk for HIV, such as a man having sex with another man or injecting drugs, then you do want to get tested more often. And these are recommended by all the preventive task force and by the CDC. So in Arizona, where can you get tested? So it looks like one place you can test it is the Southern Arizona AIDS Foundation, okay? You can get it there. You can also get tested at Teresa Lee Health Center, which is part of the Pima County Health Department. And you can get tested at COPE. And these are free testing sites. Very interesting though, with COVID, you do need an appointment for a lot of these places. So you can't just walk in like you used to. And then the next step. So we have a problem. We want to test and see who has the problem. And then we want to treat. Okay, we want to treat with antiretroviral therapy. And this treatment is recommended for all persons with HIV infection. It reduces the morbidity and the mortality for people with HIV. And it also prevents transmission. A lot of good data out there shows that basically, if your viral load is undetectable, you will not transmit it to your sexual partner. So besides treating people, okay, for HIV, another prevention method is called PrEP, okay, because as you can see on this slide, only 51% of persons living with HIV are virally suppressed, okay, so 49% aren't, and they can go out and infect other people. So a big strategy that we have is called PrEP. As I said, it's pre-exposure prophylaxis. And it's when you give antiretroviral therapy to an individual without HIV. It's a pharmacological shield, okay? It prevents HIV from invading a non-infected person's body. Where can you get PrEP? Lots of places, okay? The list is so long, I can barely get through it. However, I'll go through this. El Vernon Family Medicine Clinic, okay, that actually is a place where you can get PrEP. It's part of Banner University. And they do accept most insurances. If you're uninsured, there's other places that may be more appropriate. But the copay for El Vernon Clinic is actually quite small. And most programs can get you the medicine for PrEP free, okay, insurance or non-insurance. It's really the copays for the visit. Campus Health, that can actually get you hooked up with PrEP, and that's actually if you're a University of Arizona student. There's Community Walgreens. This is a specialty pharmacy, and they will accept people without insurance, okay, to get hooked up with PrEP. TMC will also do PrEP, and that actually has a wider variety of insurances, but they do not take people that are uninsured. Men's Vitality Center is a place you can also get PrEP. And they also, they do not accept uninsured, and they don't accept Medicare or Access. So that may not be the best choice. Men's Medical also does PrEP. Mobile Health Program at University of Arizona. They do PrEP, and they actually go out in the community. They have a mobile van, and they provide free medical service, and they provide PrEP to uninsured persons. The Peterson Clinic. This is also a place you can get PrEP. You do have to pay for the copay for the visit, which can be quite high because it's a specialty clinic. Planned Parenthood. They also are a site to get PrEP, and they also have free HIV testing as well. So I think there's a few methods that we can do to kind of end this epidemic. The first is get tested. So if you're out there and you might have HIV because you have risk factors, and if you're out there and you don't have any risk factors but you've never been tested, you should get tested. There's also treatment. And this is, again, it's a two kind of fold advantage. One is treatment helps the person with HIV, and also helps other people not to get infected. So that's a very important tool that we have for treating people with HIV and prevention. And then there's PrEP, pre-exposure prophylaxis. And this pre-exposure prophylaxis is for people that are at high risk for HIV, and they may have a partner who has HIV, they may have a partner who's a drug user, they may have sex with other men, and these people are all candidates for PrEP. So again, we need to work together, and hopefully with this three-prong approach, we can end HIV by the year 2030.
Hello, my name is Tyrone Lopez. I'm a member of the Tohono Nation, and I'd like to welcome you to the Native American HIV/AIDS Awareness Day. In May of 2003, I was diagnosed with HIV. Later, I found out that it was actually AIDS. Several things happened with living with HIV and AIDS. There is a lot of things you need to think about. One, which is care. Two, who you're going to tell. How you're going to tell. Your family, your friends, your relatives, your significant other. The other thing is, for me, it was hard to tell my parents. When I did tell them, which was 2 years after I was diagnosed, I was supposed to meet in front of the Tohono Legislative Council to speak on living with HIV and AIDS. But that did not happen. The person I was supposed to speak with got sick. And of course, at that point in time, before I went to council, I had to tell my parents because they wanted to go with me, which was the hardest thing in my life. Also, before I even told my parents, I told a couple of my cousins and a friend of mine. And that was through email, which was hard and difficult to write. Because when I wrote that I was positive, I actually copied that and told my parents at the same time. Which, within those 2 years, like I said, I lived in silence. I did not want anybody to know. And today, I am okay of telling people my status. I'm not ashamed of it because I know things happen. And today, of all days, I am glad to share this story with you. The story that I'm going to tell you is my personal story. There may be some similarities to other stories, but when I got diagnosed, I was in the hospital for about 3 weeks when they thought I had TB. And they did an HIV test at that point in time. The TB test came back negative. The HIV test came back positive. And I was okay with it at the time. When the doctors came in and told me that I was positive. It seemed like he was more sad than I was. I know my behavior at that point in time was kind of risky. And today, well, this year will be 18 years that I have lived with this disease. And I'm so happy that I'm still here. There's been several things within my life that have come about. And again, like I said, you can live a long life with this. But when I talk about coming out, first of all, coming out as a gay man or a gay native is hard, especially to your friends, your family. But then coming out a second time to share your status with your family and your friends that you're positive is a whole new ballgame. I told my parents, which at the time I didn't know that somebody else was listening, who in turn told one of my brothers, who came to my house to talk to me and ask if it was true what my brother said. And I told him yes. The first person I actually told was my neighbor. And the only reason I told him is because he took me to the hospital that day. And I hate to say this, but I ruined his date. And so when he took me, he was trying to make me laugh and stuff. And I could hardly breathe at that point in time. I just remember telling the doctor it's okay, because they were telling me I was going to stay. After all this, in 2005 is when I came out to my parents. And when I told my parents, of course my mom cried. They're both sickly, my parents. My dad was kind of hard of hearing, so he didn't hear what I told my mom. And so when I told my mom, she was crying, and he heard her and said, "What's wrong?" And she said to him, "Tyrone has AIDS." I looked at my mom and I looked at my dad, and my dad said, "Son, there's nothing I can do for you." And I told him to pray for me. Within that same year, about a month later, I lost both my parents. To this day, I'm glad I actually told them. I know I have relatives out there that don't know that I'm positive, and who knows, if they see this, the cat's out of the bag. And then also, I've done quite a bit of speaking before to other people from the nation, not just the Tohono Nation. I also spoke at Navajo Nation at one time, and also Gila River, and then Phoenix Indian Medical Center as well. I like to say, without the support that I have from my coworkers, especially the ones I work with, like Janice Poplo and Christopher Frimbris, I don't know where I would be other than serving the Tohono Nation. I like to say thank you to Lena Anton, because she was my previous supervisor, and later on I found out she was my aunt. And so I'm glad that she took a chance on me. To this day, like I said, I do tell people this is the first time I'm actually doing a video to let people know what goes through my mind at times. As far as living here in Tucson, when I first moved here in 2009, I was looking for some friends, and then also I didn't know if I should tell my friends or not. And I met somebody who wanted to have a relationship, and I told them that I had AIDS, and they were okay with that. At the time, I was still looking just for a friend to hang out with and to learn about Tucson. My support group is very strong, and I'm very glad for that. With living with HIV and AIDS, especially during COVID, it's a scary thing. I'm afraid one day that I'll get a positive test. And who knows, depending on my immune system, how well I'll be able to face COVID. The other thing too is, with everything going on, I have been working from home, which is nice because I get to stay home and work. But for those that I serve, it's harder for them to stay home. And I know that when I make a phone call to them and talk to them, they're fine. Sometimes I talk for a couple of minutes, sometimes I talk for a couple of hours, depending on the person. And I'm so happy that they are my support as well, and I am theirs. We all need to take a chance once in a while. For me, is to come out to you through this video and letting you know. My life has changed a lot. When I was younger, I used to drink, and now I hardly drink. Maybe I may have one, but that's about it, or two's my limit. I never did drugs. So the other thing about that is I'm so happy that I'm still here. It's been quite a long time since I've done any speaking engagements, which is okay, especially at this point in time. And I like to say thank you for everything. And I like to also tell you, if somebody tells you their HIV status, especially if it's a positive one, that you please ask the person if they want anybody else to know. Because maybe you're the only person at that point in time that they feel comfortable with to tell. And maybe you can be their support as well. I ask you that, one, don't be sharing it with anybody else, because it's already hard enough to come out as being positive. Two, I like to also say, if you are positive, hopefully you're taking your medications like you should, because you can live a long life. I've seen people live a long time. I've heard of people living more than 30 years with it. And so today, of all days, I'd also like to remember somebody else. The first person I actually told, walking to their hotel after a conference, and it was an HIV conference, and that was Corey Montoya. We walked to his hotel, and I stopped him at one point in time and told him that I was positive as well. He was an advocate for HIV and hepatitis C. And to this day, I always remember him. Even though we lost him, but still, I remember him because he's the first one I told. And then also, with this, I'd like to say thank you for TIC and Marlene Jose especially for allowing me to make this video. And I hope that it encourages you to get tested, especially men. When we do testing, we see a lot of women getting tested. And so I would like the men to step up and get tested as well. Because this disease has no boundaries of male, female, young, old. This disease, you can live a very long time, like I said. But you might have to change what you're doing. You may have to change your lifestyle. And that lifestyle, it's hard to change. Because I know. I've seen it before. I've seen people change their life just as well. And I'm happy for them. Today, again, is National Native American HIV/AIDS Awareness Day. My main goal is that you get tested. You know your status. And just don't do it once. But do it once you end up with a new partner. Do it when you feel that you need to, because who knows? Things do happen. And I also say to find a support. If you test positive, there's a support that people need to go through this, because it's going to be a challenging time to do this. For me, like I said, I have a lot of support from family, friends, co-workers, and I never thought I'd had this many supporters to help me go through this path. As far as taking my medication, I take 2 pills a day. I did try 1 pill a day, but that did not work for my body. I also tried another pill, which was once a day, and that did not work for my body. So I'm back to 2 pills a day. And I enjoy a lot of things. But coming out to you guys and talking to you guys about HIV and AIDS and the struggles that we have. Because we come from small communities, sometimes the word gets out. And sometimes it's not the right information. Maybe somebody took a test and then people start talking that they ended up that they were positive. Which maybe they just took the test and it wasn't positive. The thing is, you can make a difference just by your support. Reach out. And I know that today of all days, we need to remember those that have left us and those that are still fighting in silence and those that are affected and affected about HIV and AIDS. That means the family, the friends that know about their status. And it's hard to say who's who. If you came up to me one day and asked me who's positive and who's not, I could not tell you. Because it's not my thing to do. But I probably would ask you, have you taken a test? And that's the question I will throw out to you at this point in time. Have you taken an HIV test? In order for us to get down to 0, we need to start testing. We need to start taking medications if we're positive. Or you can also take HIV medication, which is called PrEP. And that's prescribed by your doctor to help combat HIV and AIDS. It will help you from not getting it. There's also U equals U, which means undetectable equals untransmittable. And so the thing about that is, if you're undetectable, it's harder for you to transmit the virus. I also say, check into these things and see what works best for you. I also ask you to be kind to people that are coming out. And maybe you already know some people that are coming out. It's already hard enough to come out maybe once or twice. But to understand the impact on the immune system, especially coming out, is a hard thing. Because one, you don't know how people are going to react. Like I said, it took me 2 years to tell my parents. My parents knew something was wrong because I was going to the doctor more often. And so when I did tell them, I think things kind of settled down a little bit. But before my mom passed, she said to me when I told her that she wanted to learn more. But she never did because she had passed a month later. I tell you, parents, be there for your kids, especially if they're coming out to you, and letting them know, because they're just as scared as anything else. They're scared to tell anybody. They're ashamed. They could be ashamed, I should say. But it's also a scary thought of saying those words, that I am HIV positive, or I have AIDS. I know for me, it was a hard thing to do. And today, I can say, I have AIDS. Today, I can also look at you and tell you I have AIDS. I know there are still people that live in silence, and I advocate for them as well, as much as possible. I'd like to say thank you for everything, and have a great day. Hello, my name is Tyrone Lopez. I am the program coordinator for the Tohono Nation HIV AIDS program. There's 2 others in the program as well, which is Janice Pablo, and she's also program coordinator, and Christopher Frimbres, who is our supervisor. We actually go out into the field and visit our clients as well as provide certain services to them. And one of them is groceries. And it varies on the amount of groceries we get for them. But we do deliver it to them at their at their place of residency, or we can take it someplace else. We also offer a talking circle, which a lot of our clients enjoy. With that, we try to do a healthy meal as well. And we try to explain, we do an education as well, and explain what we made and try to do the healthiest thing as we can, especially for a meal. It's more of a group function and we get to talk and laugh. We also provide a holiday basket with hygiene products. We also do AccuDetox, and that's my coworker Janice and Christopher. They do AccuDetox, which is the needles or the beads. And at least if you have at least 45 minutes to an hour, they can do it for you. You just sit back and relax and listen to some music. I know it works for me sometimes when I can't sleep. I ask Janice to do mine. And I also ask that Chris once in a while does it as well. With our program, we also do education. Education with behavioral health. We do education within the cells jail. And then also at events as well. Especially for Native American AIDS Awareness Day, which is our biggest day, and World AIDS Day. We do try to do events and invite people to come to these events. We also find out that we also do the Family Wellness Day. We usually have a booth there. So we do HIV testing and hepatitis C testing, and we don't share that information. It's a need-to-know basis, and which is basically just to our supervisor. But if someone comes out positive, we do have to share that information with the hospital. The other thing about that is that we're bound by HIPAA, so that means that we can't just go and tell people who's positive and who's not. We've had people ask us before who is positive within their communities, and we tell them we can't tell them. Usually when I do education, I give a general number for the whole nation, not for each individual district. I also tell people that it will be secured. Their information will be secured as well. So, again, those are the two tests that we do, which is HIV and hepatitis C. We also do the AccuDetox. And Chris and Janice are the only ones that do that. But again, at this point in time, with COVID, our building is closed to the public, and we can't do those for right now. We do make calls to our clients as well to ensure that they're okay, and to talk to them as well, because with COVID and our clients, sometimes it feels like we're so far away. We're so used to seeing them face to face. But during this time of COVID, at least we can make our phone calls and talk to them. And sometimes it's a short time, sometimes it may be a couple hours. It depends on the client and what they have to say. We also enjoy our clients. It's like a family that we come to know. And I also like to say that I enjoy my job as well. Furthermore, you can reach us at 520-383-6200. You can ask for Ty, Janice Pablo, Christopher Firmbres. Leave us a message and we can get back to you as soon as we can. Thank you.